I started back at work today. I think it was back in March that I last worked, and we're now in July, so it's been quite a few months since I have worked. And yeah, so today was my first day back. I worked half a day, so I just worked 4 hours, and I'll be working just twice a week for the next sort of few weeks, and then I'll be seeing the doctor to hopefully try and, you know, bump my hours up. You know, my doctor and my physio suggested not to overdo it and not to push myself, because if I end up in pain, then I can end up going backwards and it's just not worth it. So yeah, it was crazy to be back. I had a lot of people in my team come and visit me and say hello, which was really nice. And yeah, it was just one of those days where it didn't really feel productive. It took me hours just going through all my emails. I had thousands of them. The stuff that's going on with work at the moment that is just stressing me out a little bit, and I'm trying not to let it stress me out, but you know, work's undergone a restructure while I haven't been there, and I still have no idea what's happening. So yeah, it's it just worries me in the back of my mind, you know. But the most important thing, and the thing I've been worried about the most, has been, what if they get rid of me, or what if they fire me, what if I no longer have a job, you know. It's just a bit of a relief that, you know, that I have a job to go back to, and you know, I can start earning some money, because, you know, my medical bills are still increasing, you know. Well, they're not increasing, but you know, my medical bills are still there. You know, I'm paying them really slowly. So I'll just be relieved when I can finally get rid of all of them. It's just taking a longer time. But other than that, I am still on crutches. So I'm still using my elbow crutches. And I feel like I am progressing very, very slowly. I'm still limping, but my pain has gotten better. Haven't been taking my usual Panadeine codeine, so I was taking that for pain relief every single day, and a lot of the time I take it a few times a day, and I haven't taken them for, I don't know, at least half a week to a week now. It's been quite a while. So if I am achy, or if, you know, my leg is sore, then I've just been trying to take Panadol Osteo instead, and that seems to be doing a really good job. The only other medication that I'm still on is Targen, which is a slow release painkiller. Unfortunately, I think I'm at the stage where my body has become dependent on it. I'm not taking it for the sheer fact that I feel like I want to take it, you know what I mean? Like I'm addicted. Like it's hard to explain. Like, you know, if you're sore and you go, oh, I'm just going to take this, you know, it's not quite like that. It's more that I'm finding that if I don't take the Targen, I start to get a really bad headache, and it turns into a migraine. And I tried to completely go off the Targen, and I think I was off it for about a week or two, and I had a migraine for the entire time, and it would not go away. And I ended up taking Mesindol for the migraine, and I was taking Mesindol multiple times a day, every day. It was excruciating. It was a really bad migraine. Towards the end, I thought, I'm just going to see if the Targen makes a difference, and I took it, and the migraine went away completely. So it pisses me off. I mean, that's probably the best way to put it. It pisses me off that I have no control over my own body, that my body is wanting this medication, and I'm fine without it. You know, I don't need it for the pain, but my body goes into meltdown because it doesn't have it. So it's really frustrating. You know, I get a lot of people that criticize me and tell me that I shouldn't be taking this and that, and I just feel like saying, you think I don't know this? You know, it's like, I want to get back to a normal life. I don't want to be on these medications. I don't want to be doing this or that, you know. Very, very frustrating, you know. It's, yeah. But on a positive note, I'm super happy that I've been able to stop taking the Panadol codeine, and I have switched over to just the Panadol. So I feel like at least, you know, it's a bit of progress. This is the lounge room set up at the moment. So I've still got my little recliner chair. I did have like a side table. We were renting it, but I decided to return it because it was just so expensive. It was hundreds of dollars, and you know, I've had this table in the garage for quite a while, and I used it for markets whenever I'd sell things at the markets. And I just said to hubby, look, I'd rather save the money and put it on my medical bills and just use this table. I mean, it's huge, but at least, you know, next to the chair I can, you know, have my breakfast, you know, go on my laptop, have a coffee, things like that. So, but yeah, but the recliner chair I am still using. I'm actually sitting on the normal couch at the moment, which is a pretty big milestone, I must say. That's Charlie's little tail. It looked funny there. Yeah, I haven't really been, I guess, using normal things. So like I haven't really been sitting on the lounge room chair. God, my hair's a mess. Yeah, just for the sheer fact that the lounge is quite low and it's quite soft, so you kind of sink into it, and sometimes I just find it so much more comfortable with the recliner because it has a really firm seat, and it also heats up, and it has a massager in it. So, but I think ultimately the heating function in winter has been amazing, because I find that, you know, if I get a little bit achy or sore, that heating element is just so perfect. It's just, yeah, it just makes it nicer, you know, somewhere to sit. But I'm finishing up my physio and my hydro soon, so that should be finishing this week, I think. I'd hoped that I would be there till 12 weeks, but I sort of get the idea that I'll be finishing this week, which this has all been through the hospital that I got my hip replacement through. And so I will have to look into another physio to basically pay to have, you know, like to get physio done or get a program created, things like that. It's been really wonderful doing the physio though. I've progressed a lot, I really have. Yeah, I've still got a long way to go. I'm just going to walk a little bit without the crutches just so you can see. Muscle weakness in my hip, which is, you know, preventing me from walking properly, and it's the reason I still need to be on crutches. I am seeing my specialist in August, so that will be sort of like my 3 to 4 month checkup since the surgery, which was in April. And yeah, I guess I'll get a bit more of an idea of my, you know, recovery and how it's going, and yeah, hopefully as I keep updating, you know, I'll just get that little bit closer. I am super excited. Don't mind me, I am still in my pajamas. It's very stylish. I'm still in my pajamas. It's Saturday and I'm going out tonight, out for dinner with a few of the girls. So I have some fake tan on, and yeah, I haven't had a shower or anything yet. But I wanted to update, and I guess just to document this, because I'm pretty impressed, I have to say. So yesterday I had my physio and hydrotherapy, and it was the second time that I had like a deep tissue massage, and I had a different lady do it this time at my physio, and she did like a lot of release work, but she really pushed into my scar, and it was so painful. Like, it was, the whole time I was basically squirming and like trying not to scream and cry, and it was full on. But I have noticed such a huge difference from Tuesday's physio session. That was my first sort of release work, deep tissue massage. And I noticed doing my exercises yesterday, I was able to move my legs more, I was able to lift them a little bit higher, I was able to do things a little bit easier. And I was excited because it was really the first time that I've sort of started to sort of like get around another corner and make some progress. So at the end of my session, I ended up getting another deep tissue massage, and I've just noticed such a big difference. So at the moment, I am walking around the house without my crutches, and I'm still limping quite a bit, but it's a bit hard to kind of tell. But I'm able to keep a little bit straighter when I walk. It's like I can walk just that little bit. Yeah, like, I mean, normally when I sort of try and get around the house, I've still been using my crutches, but I just try as much as I can without them. So I'm at least, you know, trying to promote or trying to push this, or trying to just sort of push the muscles to be working, you know. And yeah, so all morning I've just sort of left my crutches there, and yeah, I'm just sort of walking around without them. But I'm excited because I'm finally seeing a little bit of progress, and yeah, my goal is to be able to walk again without my crutches and just get back to a normal life. So yeah, until my next update. Hey guys, so I thought I would give you another update. I'm into my last week of my physio at the hospital that I've been going to, so it will actually be my 11th week in doing physio there. It's been now 15 weeks since my surgery, and this Friday will be my last session of doing the physio program. So my physio has asked me to book in with I guess a new physio sort of outside of the hospital, as well as a massage therapist, so I can continue working on my progress with walking and everything. In the last sort of, I'd say 2 weeks, I think I've just noticed a big jump in progress. And I did look up online on some forums, and a lot of people were mentioning that apparently walking backwards and teaching yourself to walk backwards actually helps with reversing a limp, or helping with a limp when you're walking. So I've actually been doing that, and I'm not sure if it's helping or not, but I figured, you know, I'll give it a go. Anything sort of will help. But I definitely have noticed a lot of progress in the last, especially in the last week, where I'm able to get around most of the time now without crutches, mainly at home. I still don't feel strong enough and confident enough yet to go out without both of my crutches, but around the house I either get around without them at all, or I'm just using one of them. I'm still limping quite a bit, so I'll sort of show you guys a bit. It's definitely improved, but I still have a slight limp, and I'm just really trying to work on it. My sort of exercises that I've been doing is I can actually stabilize when I'm walking by holding the wall, and then when I get to the end, and just start walking backwards. And I feel like when I push up against the wall, it just sort of helps, you know, like stabilize. It's still just taking a really long time. Yeah, it's just such a long process. So I've booked in to see a physio. Hopefully as time goes on, you know, it improves every day. I have noticed a big difference lately, so I'm hoping that it continues that way. I'm still on one crutch, but I have been walking around the house pretty much with no crutches for as long as I can sort of handle it. But I have been practicing with my limp and my walking. So this is where I'm up to. And so when I balance, this leg's fine, but then this leg, I'm still having a lot of trouble, and you can see my whole body tilts. I can't stand on this leg just yet and balance on it, so it's still quite weak. I had my last day of the hospital physio, so that was 12 weeks, so that was this morning. So I've kind of technically graduated, and I'm actually about to head over in Tuggeranong in Canberra to see a new physio, and I'll be continuing to see him basically until I can walk properly again. So until then, it's just still practice and exercises and physio, and I've just been using one of these crutches to just to help stabilize, and on the days where I'm really, you know, sore or in pain, then I use the two of them. Next week my hours have been bumped up from work, so I've gone back to work and saw the doctor, and my hours have been bumped up to Monday to Friday working half days, so it's all a bit of progress. But I realised yesterday, which was the 7th, it was actually my hip replacement anniversary, so it was actually 4 months since I had the surgery. So I just got back from my first sort of physio appointment outside of the hospital, and yeah, it was an experience. My physiotherapist name is Ads, and yeah, he did some sort of deep tissue massage and release work all on my hip and my glutes, and I think my diaphragm and some other muscle that runs along the left side of my body, and it hurt so much. It was seriously like nothing I've ever gone through before, and yeah, it was pretty full on. So he's given me this sort of program to stick to, and to do these exercises sort of, you know, once, twice a day, every day, and for the next 6 weeks he wants to see me every week. And part of those exercises is doing some ball work, so just sort of rolling out my glutes. He thinks that that's the main problem, so that's sort of what I need to focus on, is, you know, the side and the back of my butt. What a full-on experience. He did this cupping work to my scar on my hip, where they have this, like, you know, like glass, I don't know what you even call it, like a glass cup, and it's got like an opening, and they push it against, you know, the skin, and it suctions the skin up into it. And so, you know, say this is my scar, he basically had it, and he was just like rubbing it up and down, so it was pulling the skin where the scar is, because I've got a lot of scar tissue. And then yeah, he just did, yeah, it was, oh, it was so brutal. I think in between laughing I was like swearing. So yeah, that was an experience.